Hi guys, welcome to day 2 of week 1. Today what I want to focus on in the video is the remainder of the chapter 1, and I also want to discuss chapter 2 and chapter 56. So, if you remember from the day 1 video, chapter 1 is really an introduction to the healthcare field. In the day 1 video, what I did discuss was how a medical assistant is really kind of a newer generation of the medical healthcare field. But I also talked about how individuals become accredited and certified. So today what I want to focus on in the day 2 video is I want to talk about those responsibilities and the qualities of a medical assistant. It's important for you to know that you always must perform your tasks or duties within your scope of practice as a medical assistant. Doing a task that's outside of your scope of practice could end up harming not only you but your patient. Okay, so it's really important that you stay within your state and your personal scope of practice. When we talk about the responsibilities of a medical assistant, these are really broken down into 2 categories. They're broken down into administrative and clinical. Administrative tasks are going to be those found more in the front end of the business. Billing, insurance claims, dealing with the mail, taking phone calls from patients, scheduling appointments, all of those things are considered administrative. Clinical medical assistants, on the other hand, do more with the back end of the business. Rooming the patient, obtaining a medical history, taking vital signs, performing blood draws and lab procedures, doing inventory of the supplies. Those are all clinical medical assistant responsibilities. Now that we understand what the responsibilities are, maybe we should talk about what qualifies and what qualities make a good medical assistant. So the number 1 quality that helps a patient or a medical assistant be proficient is having integrity, being honest. Okay? You also want to have empathy and be able to show compassion for your patients and coworkers. You need to have discretion, which means that you can make sound decisions without having your feelings and emotions get involved. You need to have confidentiality and be able to keep information private. You need to have thoroughness or be attentive and show pride in the work that you do. You need to be punctual, show up on time, be dependable, be somebody that's reliable. You need to have congeniality or be able to get along with a group of diverse individuals. Whether you like them or not, you can get along with them in the workforce. You need to be proactive. You need to take charge and anticipate the needs of needs of your provider and your patients. Be ready for what could happen. And the last quality would be you need to be competent. You need to stay current on the changing and evolving healthcare field. Alright, so that's going to finish up chapter 1 for us. Let's talk about chapter 2. Chapter 2 is really discussing history of medicine and the influential individuals who helped create and form medicine as we know it. So that first individual that I feel is really important to know about is Hippocrates. Hippocrates is known as the father of medicine. He stressed that the body's healing nature helped to form descriptions of diseases, and he also helped to discover the ability to identify diseases by listening to a patient's chest. Think how often nowadays that's the first thing providers do is they listen to a chest. Well, now you know where that came from. Hippocrates is also known for creating what we call the Hippocratic Oath. This is a guide or a pledge that providers take that states they will do no harm to their patients, prescribe no deadly drugs, and give no advice that could cause death. So all of the providers will take that before actually stepping into their role as a physician. Now, while there are very numerous amounts of other important individuals, I'm going to leave that up to you guys to read about. Hippocrates is the one that I know is really important for everyone to know about, so that's why I wanted to touch on him. So please make sure that you read the rest of the influential individuals found in Chapter 2. Chapter 2 also discusses the different types of medical practices that are available. I'm not going to go over what the individual different types are, but what I will say is that it's really important to know that just because they are individually different, you can also break them down a little bit further and go into specialties, things such as allergy, asthma, endocrinology, diabetes. You can have, OBGYNs. Those are all different specialties. And what's really important to know is that medical assistants do work in these specialties. They have the same responsibilities that they would in a general practice as they would maybe in a gynecology office. But their roles might be a little bit different. Instead of having to know a vast majority of different diseases, maybe they just need to know the ones focused with gynecology. And while medical assistants really work in outpatient settings, it's important to know that there's always change in medicine, and one day we could work in inpatient settings. So all of those clinics that medical assistants currently work in are considered outpatient clinics. I don't want that to get confused with what an inpatient clinic is. The last section of Chapter 2 that I really want to discuss is the part called Allied Health Professionals. When we talk about what this is, it's really broken down into 3 different categories: registered, certified, and licensed. Now, it's important to really know the difference between those 3 different types. Registered means that professional organizations in a specific healthcare field administer exams and maintain a list of qualified individuals. So essentially your name goes on a list, kind of like a voter's registration. An example of that would be an RMA, or Registered Medical Assistant, and that is offered through AMT, or American Medical Technologists. A certified individual is one that is being issued a certification or credentials by a professional organization and by an organization that has met specific standards on education and experience. So if you think back to day 1, we talked about the double MA, and they offer that CMA, or Certified Medical Assistant. That's what a certification would come into. The last would be a license, and this means that a government agency, which is usually a state agency, authorizes individuals to work in a specific occupation. For example, a registered nurse, a licensed practical nurse, items like that. Alright, so Chapter 2, that was a quick wrap-up, but please make sure you read the entire chapter yourself. And the last chapter for this week is Chapter 56, and this chapter is really dealing with patient education. So as a medical assistant, this is one of the roles that you get to play. You get to pass information on to your patient as ordered by the provider. These could be information regarding lifestyle changes, preparations for surgery or procedures, or maybe disease-specific information and treatment plans. It is important to understand that any patient education you do will need to be altered and changed for every patient. Not all of us learn in the same way, in the same manner, with the same material. So we have to really adjust it and make it fit to our patients. So when we're doing patient education, there are really 5 steps to this. The first step is the assessment. And what that is this is really the beginning stage. What we do here is we determine and we define what the patient's needs are. Second stage is our planning stage. This is where we're going to go in and we're going to determine how the tasks need to be taught to our patient. Then we're going to implement that plan in stage 3. Then we're going to really take that teaching and we're going to involve the patient in it, and we're going to get the patient specifically involved and tell them what they need to do and how they need to do it. Step 4 is a very important stage. This is the documentation stage. So anytime after a patient education is completed, you need to document that in the patient's chart. Reason being is we need to be able to follow up on that, and we need to make sure that the education was done. In case the patient came back later and said, nobody ever told me how to do that. I never knew that. Well, you've documented that you did that patient education, so that's the important piece there. And the last stage is that evaluation stage. So at the next patient visit, what you should be doing is either you or the provider will go over and be like, hey, how did that education go? How did those tips go that we've been teaching you, and how is that working for you? So that way we can either, again, adjust that teaching or maybe adjust the treatment plan based on what the provider and the patient say based off of their former treatment plan. So now that we understand how your education must be done, remember, I did say that it needs to be altered and changed for every patient. So when you're developing a patient education, there's a lot of things that you need to take into consideration. The first thing is the teaching method. Are you going to do audio? Are you going to do video? Are you going to do handouts? Are you going to do hands-on? Think about the different ways that, and ask a patient, how do they best learn? The second thing you need to think about is the teaching plan. And along with that comes the learning objectives. What is the outcome that you want to happen or the provider wants to happen after this teaching? You also need to think about the learning environment. Make sure it's somewhere where the patient can focus. Don't do it in the waiting area where he or she would be worried about somebody else hearing. Do it in a private room with that patient. You also need to really consider the teaching resources that you give. Make sure those resources are helpful to the patient. Sometimes handouts and pamphlets are not helpful for patients, but maybe having handwritten orders or being able to let them practice on themselves would be really helpful for them. So always think about those things. Remember, a good teaching method from the medical assistant can really empower the patient to change their life for the better. And in order for the patient to feel that they can make those positive changes, you as a medical assistant need to be the role model. Make healthy decisions. Have healthy behaviors. If you want your patient to stop smoking, probably not best if you smell like, a cigarette or an ashtray. So those are always very helpful. Always make sure that you as the medical assistant are making positive and good behaviors that a patient can mimic. All right, everyone. That is kind of a wrap-up for this week. If you have any questions, please always bring them either to class or to me, and I look forward to seeing everyone in a week. Have a wonderful, wonderful week, guys, and I'll see you next week. Bye-bye.